welcome today to this week's edition of the Research Sofa. I'm here today with Dr Chris Griffiths, who's going to talk to us about his project that's been recently funded by the Closing the Gap Network Plus funds. So, Chris, can you just tell us a little bit about yourself first?
Yeah, sure. So I work for Northamptonshire Healthcare Foundation Trust, so an NHS trust, and we provide community-based services for the whole of Northamptonshire, which is around 800,000 people, and also inpatient care in terms of mental health and dementia. So yeah, I'm very privileged to be able to work directly within a trust. So I'm a mental health researcher by background. And so I've worked for a variety of universities and charities and healthcare providers. But I do have a particular interest in the interlinks between mental and physical health, and how we might engage with people both through mental health and well-being, but also their physical health, to seek to improve both aspects of their lives.
Yes, that's one of the things that we're really interested in Closing the Gap, is improving people with severe mental illnesses, physical health. And so the project that you're working on is called the WellTrack project. And I just wondered if you could tell us a little bit about the project and where the idea came from.
Yeah, sure. So it's a collaboration with Coventry University. The other members of the team are Kate Walker, who's based here, and so Kate's a research associate and a specialist in qualitative research. And then we have Ksenia De Silva, who's based at Coventry University, so an associate professor there in neuropsychology, and also a statistician. But I think it's also very important to remember that this project emerged out of a need identified through our clinical services. So we've been working very closely with the operations manager, so Sue Dugan, and also the lead psychiatrist, Dr. Marlene Kalbrick. So yeah, it really emerges out of this identifying a need. We know people with early episode psychosis are less likely to be physically active, to engage in physical exercise, higher levels of sedation, and also high levels of sleep problems. And all of these factors can negatively impact on your mental, your physical health, your well-being, but also life expectancy. So that was really, kind of the basis for this idea, which was based in the needs of patients and the understanding of these needs and how they're addressed within our clinical services.
So what's the WellTrack project going to be doing then?
Yeah, sure. So what we do know is that engaging in physical exercise to effective healthy levels and engaging in effective sleep is beneficial. So these are fundamental facts for all of us. What we also know is that having a Fitbit and sleep hygiene advice, exercise advice, so they're kind of the best advice around these kind of topics, is of value. Research evidence shows that it can improve your mental and physical health and reduce your level of disease, which obviously links to life expectancy. So fundamentally, what we're doing is giving somebody a Fitbit. So we're saying that you can have this for free. You don't need to hand it back, and engaging with them at 3 points. So giving them a research developed, research-backed sleep hygiene sheet, but in a very sort of user-friendly designed information sheet, and also one developed around physical exercise and activity tips, links, and those kind of things. So that is the fundamental basis of the intervention. But the other aspect is the engagement with the person. So it's not just handing them these things and people going away. So engaging at 3 points. So see how people are getting on, do they need some support, just that kind of general kind of chat, which our clinical services will do. And then the final contact point will be where we as researchers will contact the person and ask if they would like to be interviewed. So a more in-depth, semi-structured interview, basically seeking to find out, well, what is their experience, what are their thoughts and beliefs around physical exercise and sleep and how it affects them. But obviously also key the question around, well, what has been the impact of this intervention in your life? What changes have you made? What impact has it had?
Yeah, so that all sounds good and really interesting. We look forward to hearing the results from that study and seeing where it takes you next.
Yeah. Yeah, sure. I think that is important, obviously, to think about, where we do go next with this. I think this is very much the way that we can achieve this is having buy-in from our services. So that's fantastic to have Sue and Marlene on board to essentially make this happen. And then where we go next is a very interesting question as well. As a researcher, we're always thinking about what could be the next funded piece of research. But being based in clinical services, also thinking about, well, if this is effective, how do we roll this out? How do we integrate this within services? There is a cost. A Fitbit costs a certain amount of money, but that cost is relatively negligible if you think just one contact point with a psychiatrist is probably more than the cost of Fitbit. So there's sort of those two areas of where we want to take this forward in terms of implementation and also further research that might be done.
Well, thanks for talking to us today, Chris. Really pleased to have you on the research sofa and to hear about your project, and good luck with it. Thank you.
Cheers.
Thank you. Bye.